One of the things that we really had to work with was timing, and to make sure that we were staying within compliance of the NSA guidelines, and we had a short time frame to get all those appropriate teams together to pull this off. One of the biggest opportunities that we identified as we were working through the NSA process was our scheduling shortcomings as well as our estimate shortcomings, and we were able to turn over what issues we needed to address in order to make sure that we were staying within compliance, whether it was scheduling accounts appropriately with identified insurances, and if they were not, how we were going to identify that patient as a true self-pay to make sure that we could stay within the time frames required by NSA. I think the larger benefit or the ease of use for Banner Health actually can be reflected in the patient's experience. Patients are actually getting their information faster and it's more appropriate as opposed to waiting. We were able to function in a way that allows these patients to get their estimates in an appropriate time frame. The benefit to Banner Health is that we have higher patient engagement scores, higher patient satisfaction scores. So the requirements for 2023 with NSA and how we're going to partner with Experian Health, it's essentially the same requirements, but it's going to be expanded. Now, instead of requiring estimates within an appropriate time frame for self-pay patients for one type of estimate, whether it's a facility acute estimate or a provider ambulatory estimate, now all these are going to be combined into a convening estimate, where all subsequent providers that may have some type of involvement in that care are going to be providing their estimates in one lump estimate. So the acute side, the professional side, everything will be reflected in one, in addition to some of those behind the scenes providers that maybe patients don't interact with as much. Their anesthesiologist or maybe a reading radiologist will be able to get all of those estimates into one form, and our hope is to partner with Experian to allow for all of those estimates to be combined into one function to present one estimate to the patient.